All right, we are live. So welcome to today's live broadcast stream for today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV Comcast and Frontier Government Channels 96 and 6032. It'll also be streamed via hpa-tv.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It will also be rebroadcast and made available on the HPA-TV YouTube channel and Vimeo channel. So today we have one item on the agenda, and it's an update from our Health and Human Services Department. We have our Assistant Director here, Mrs. Carmen Shapiro. The floor is yours.
Great. Good evening, and thank you very much, Councilman LeBron. And you know, I stand in for Liani, who's on a much needed vacation. So I just a quick update on, we'll start with monkeypox. The city has a total of 3 cases as of this weekend. We currently still have 2 individuals in isolation. So I'm sure you saw that last night and today DPH rolled out vaccines into the city and throughout the state of Connecticut. In the city of Hartford, they're working directly with Intra-Community, which is right here in the north end around the corner from us, to help vaccinate individuals. And individuals who meet certain criteria may be vaccinated. These criteria include persons identified by state and local public health as being close contacts to someone who has been tested positive for monkeypox, or Connecticut residents who meet the following criteria: men who have sex with men, gay, bisexual, transgender, gender nonconforming, or gender non-binary, and aged 18 or older, and have had multiple or anonymous sex partners in the last 14 days. And more information can be found about monkeypox at the Department of Public Health portal at the state of Connecticut, if there are any questions about that. And Councilman LeBron, do you want me to just go ahead and continue on to COVID, or do you have questions specifically for?
I think that, thank you for that, Mr. Shapiro. I think that monkeypox is so heavily, talked about now in the media, and I think my colleagues and I are getting constituents that are reaching out. And so I'll stop here for the monkeypox update and see if any of my council colleagues have any questions. Councilwoman Rossetti?
No, thanks.
No, thanks. Okay. Councilman Sanchez?
No, I'm good. I've been watching the news, and it seems to be a slight uptick on the monkeypox, but it hasn't broken over 100 possibly. Am I correct?
Yeah, I think that is correct. I think that, most municipalities are averaging right around, lingering right around where we are at. So, we continue to have the contact tracing for this as well. So if there's somebody that's been identified, even if they've been identified in another community, but have identified a contact that lives within the city limits, then we'll track and monitor those individuals as well. But yeah, overall, we're, I don't think that, I'll say yet, it hasn't skyrocketed yet. So we're at 3 cases right now.
Okay, I do have one more question. So, and again, following the news and what I hear on the media and all that, is there an uptick on some other diseases? I'm not sure if it's a bird flu or something to that effect that have occurred here a few years ago in Connecticut.
We haven't seen anything, come across our desks as something that we need to be, on the, we're always on alert, but to the best of my knowledge, I haven't seen anything come through where we would need to, to be worried at this point. That could change tomorrow morning. Yeah, I'm not sure.
Right. I remember a few years ago when there was an issue when we had a huge amount of mosquitoes in the state, and they were transmitting some kind of disease where now the high schools and the football teams weren't able to practice outdoors in the evening because of the scare. And I can't recall that disease that I'm trying to mention here. But thank you.
Yeah, and just we did do mosquito spraying in Keeney Park last week, and we did all of our drains in the city of Hartford have been treated for mosquitoes and will be treated again in another month or so. Okay, so on to COVID. Our numbers are still.
So, Mrs. Shapiro, I didn't get a chance to
Yes,
answer any questions
Oh,
regarding monkeypox.
sorry.
So, the first question I have is regarding monkeypox. I remember, I mean, we're coming off a pandemic, or at least, or maybe the tail end, God willing, the end of a pandemic. And I remember in February of 2020, we had a meeting in Health and Human Services where we discussed COVID prior to us even having any case. In your opinion, or your office's opinion, are we seeing the same trends in terms of numbers, or is this something that is targeted or headed in a different direction?
I'm sorry, so just for clarification, trends with monkeypox?
Well, let me be more specific, right? So we had 0 cases in Connecticut in February of 2020. And by March 13th, we shut down, right, of 2020. Well, most of the country shut down. We have 3 cases of monkeypox now. In terms of its prevalency, I don't know if that's a word, or its prevalence, are we heading in that direction where we should be worried? Or is the number so low that it's something that's manageable?
So I will say this, I defer to the true experts at CDC and, all of those scientists. What I can say is that the spread of monkeypox is very specific from what we know about it. And so it does need to be, skin to skin contact, and, with like open lesions. And so the specificity of the way that it is currently transmitted makes for it, to be less spreadable. That's my Monday night word, less spreadable than something like COVID, which is, airborne.
Got it. Thank you. And then you said there were 3 folks that had monkeypox, and they're in isolation or they're quarantining. Are they're doing that at home, or are they being housed somewhere?
Nope, they're doing that at home. So we had 3 cases. 2 of them are actively still in isolation, and they do that at home.
Okay. And is there any cure for it? Any treatment?
So there is. There's vaccine for those that have been, potentially exposed, but then there's also medication that they use for smallpox that's being trialed through the CDC. So one of our cases did actually use that 14-day regimen.
And lastly, on monkeypox, there has been trends, or I'm trying to think about the right word to use regarding monkeypox, and in terms of targeting specific population and creating what's the word I'm looking for? Like targeted efforts towards the LGBTQ community. Can you explain a little bit more of that and dive deep in what are we doing as a city to prevent specific profiling around any demographic from being focused on as to spreading this disease?
I think that the messaging has been, I think people are trying to be very cognizant of the way that we are messaging and talking about what populations are currently being most impacted by this. I think that, we have some experts at the table, like the Hartford Gay Lesbian Collective, who tends to be very well versed in the way that they communicate about their specific population, which is the population that's being most highly targeted at this point. And then interestingly, I actually just read an article today around the racial implications of using the term monkeypox. And so there has been a push to ask the WHO, the World Health Organization, to change, to maybe rebrand that name a little bit, so that it doesn't carry such racial connotations for our communities of color. I'm not sure if that answers your question, Councilman LeBrun.
Yeah.
I can say that, I think that we're working with really good partners who are really cognizant of the way that people are treated and portrayed in our city. So, we'll continue to look at them.
Thank you. I just wanted to just make sure that, that we mentioned that to our communities and the folks that are listening, and that, we're definitely understanding of that. So lastly, with vaccines, I know the vaccines rolled out today. Is anyone eligible for vaccines? Who should be the ones getting the vaccines?
So anybody that has been identified as a close contact to somebody who has tested positive for monkeypox, any Connecticut residents, including men who have sex with men, the gay, bisexual, and transgender population, gender non-conforming or gender non-binary, anyone that is age 18 and older, or anyone that might have multiple anonymous sex partners, or have had anonymous sex partners over the last 14 days are encouraged to get the vaccine.
Thank you. Any further questions? I don't know. I asked some questions. Sometimes it may elicit more questions from my colleagues. I see none, no hands raised. All right. Thank you, Mr. Chaparro. We can move on to the, I believe there's a new COVID strain. So.
Yeah. COVID. So our numbers are kind of bouncing, around a little bit over the last 2 weeks. They've hovered about 125 to 170 cases over this last 7-day period. Our positivity rate has hovered around 10%. We continue to vaccinate here at the department. We're averaging probably like 10 to 15 people every Wednesday evening that we have our vaccination clinic. The majority of it are individuals coming in for their boosters. So we'll be doing a big push here, especially with people going back to school, maybe people then as a result going into the office a little bit more. So we'll be doing a bigger push over the next month or so with our community partners to encourage folks to continue to get vaccinated and to continue, to go get their boosters. We're just shy of about 70% of the residents in Hartford have gotten the vaccine. Nearly 62% are fully vaccinated. Fully vaccinated means that individuals have received the first and second doses and at least one booster. We have over 27% that are boosted. I might have just misspoke, so I'll go back. I will reiterate. I will check with Leonie tomorrow, but 27% have been boosted, and the booster coverage is 69% among the 65 plus community. So just like we saw with the uptake of the first 2 doses of the vaccine, we're seeing our seniors as the highest, the population with the highest uptake of the booster. So we're still at it.
All right. So questions, Councilwoman Rossetti?
Thank you, Mr. Chair. So I have a couple. First, do we truly, first is a statement, so I'm lying. It's not a question. Do we truly know what positivity is with all the home tests?
So that's always kind of been our thing, right, Councilman Rossetti? It's that, because people are not reporting, into a state system per se that they've tested positive at home. I don't think that we can say that, we do have a true sense of what the positivity rate is of those that are taking the PCR tests. That's really the information that we're receiving.
And do you think, and again, I'm not asking you to, so, when we were thinking back in the beginning, or when we were tracking, like me, I had a spreadsheet, positivity rate now I mean, maybe we're going to get to a positivity rate that we didn't think we would get to, that we're going to be able to live with. I mean, maybe the 5% of before is our 12% of now. Do you think, or, something like that? Because the work that I'm in, where I am with one of the state contracts we have, and I'm not saying this, I don't mind wearing a mask at work, but the thing is, we can never not wear them until we're under 5%. And I don't think we'll ever be under 5%.
So what I want to say to you is that that's probably above my pay grade.
Okay.
I mean, I think that I think that the message that we, as a department need to continue to reiterate is to emphasize, safe
Yep.
habits, right? Washing our hands, staying home if we're not feeling great. If, there's so many people that are like, oh, no, it's just my allergies. This is just my allergies. And maybe it is. I mean, I was sick 2 weeks ago and I literally was like, I don't know how this cannot be COVID. And I think I took 7 tests and my PCR came back negative. And I was like, there's no way. But my PCR came back negative.
No,
I
know
okay,
when I took
COVID.
one time, I took like 2 in one day. I was like, I have to,
Yeah. And at the same time, we've had people that are like, this isn't COVID. And they take the home test. It's negative. They take one in the morning. It's negative. Start feeling a little icky during the day. And then at night, they test positive. So I think it's just important to to remember to stay on top of our health, to, know when we're not feeling well, know that, we can, use our strategies to make sure that we're not exposing others to something that we might have, and it's the same thing here in our department. We wear masks, all day long if we're not in our offices.
Right.
And so, I think we do that out of an abundance of caution, but we're also a medical building, right? So people are coming in here, they're vulnerable. Some might be sick. Some might just, have heart conditions or other, predisposed conditions. So I think it's just a matter of being, cognizant, using strategies that we know work, covering our coughs, washing our hands, wiping down surfaces, those types of things that help just in general mitigate not just COVID, but other, flu, because we're heading into that too, right? So, all those things that we can do to just all those health strategies that we know are work. As far as the trends, I just haven't read enough about it to be able to tell you, I think that over this amount of time, we'll get to, a point where it's under 5%. So I apologize that I don't have that.
No, that's fine. That's fine. And Mr. Chair, can I ask one more? Does your department, I don't want to put you on the spot, have any opinions or thoughts on, and because I've read a couple of different things on people waiting if they haven't gotten that 4th shot because there's going to be a newer shot. So can you get the 4th one and then get the newer one, or should you wait for the newer one? So any opinion there in your department?
Well, my opinion is that if you're eligible for that 4th booster, get the 4th booster. Don't wait around for the potential of another one. There may be another one, I don't know. But if you're eligible for it, get it. And it's, readily available. So, that's really my recommendation.
Thank you. That's very, very informative. Thank you, Mr. Chair.
Thank you, Councilwoman Rossetti. Councilman Sanchez, any questions?
No questions. Thank you.
Okay. So, Mr. Chaparro, at one point, Director Arroyo had indicated that we were able to get more accurate numbers through the sewage. Are we still doing that? Is that still a thing?
Through the sewage?
Yeah, like they would test through
They test the wastewater. It's
the wastewater.
Indicator. It's a pre-indicator of what's to come.
I was like, did I just make this up? Okay, yes, wastewater. Yeah.
No, you did not make it up.
It's public health, so really, I mean, we don't. I really can't speak to that. I don't have enough information on that to be able to give you a good answer. I'm sorry.
It is really interesting. I think what I've read that it's very accurate, but it's also very costly and time consuming to do, but
Yeah, that's why I was curious to see if
Yeah,
it was
yeah.
still being done. I'll follow up with Director Arroyo. The
Yeah,
other
she'll be
thing-
back tomorrow. So.
Okay. All right. And I think you answered the question from Councilwoman Rossetti, but just in general, we're using this watermark of 5%. Now, if it goes under 5%, does that mean that it's essentially like a flu and an endemic? Is that what the thought process is around the 5%?
I hate to say this, but I'm not really sure. Yeah, I would have to check on you for that. And
Okay.
certainly I can talk to Liani and get back to you.
No problem, no problem. And thank you for filling in today and giving us the information. Is there any other updates that you may have, Mrs. Chaparro?
I don't think so. I think, I gave the update. We did the mosquito treatments last week. So, and then we'll do them again in about a month or so. We will be getting our flu vaccines in, probably at the end of this month now. So we'll be open and ready to provide flu vaccines to the community members and to city staff as well. And yeah, just look for us in the community. There's, we're still having partners that are doing door to door. I think next weekend, the Yukon team and the docs and residents will be going door to door, providing vaccines. So you'll see folks, out on the streets and, pounding the neighborhoods to continue to bring awareness and to provide vaccines to those who may want it and need it.
Well, thank you very much for filling in and pinch hitting for Director Arroyo. And with that being said, I'll take a motion to adjourn.
So moved.
All right. Second. All right. So we're adjourning. Thank you for joining us, and for those who tune in, have a wonderful Monday evening.
Thank
you, everyone. Thank you, Attorney Osborne.
Well,